Hello everyone, welcome back to the channel The Upcoming Doctors. So in this session we are going to discuss about the topic that is cubital fossa. So what do I mean by this cubital fossa? First of all, the cubital fossa means it's a shallow depression, right? The fossa is nothing but the shallow depression, and so the cubital means regarding the elbow, it is related to elbow. So the shallow depression which can be seen in front of the elbow is nothing but the cubital fossa, and it is also called antecubital fossa. Please remember this point, the cubital fossa, otherwise called antecubital fossa. Anti spelling is A-N-T-E, don't write A-N-T-I, the meaning will change because, okay. So the area of transition between the anatomical arm and the forearm, whatever the area is present in front of the elbow, it is called cubital fossa. And why it is so called the antecubital fossa means the same meaning, but cubital means elbow, so anterior. Here the anti means anterior, A-N-T-E, so anterior to the elbow, that fossa is present, so it is called antecubital fossa. So the triangular hollow in front of the elbow is called cubital fossa, and it is homologous and corresponds to the lower half of the popliteal fossa of the lower limb. And what is this popliteal fossa? Let us take a look. So here we can see in this picture the cubital fossa and the popliteal fossa are present, right? So this is the cubital fossa. This is the cubital fossa, and right side you can see the popliteal fossa. On the back of the knee joint we can see this popliteal fossa, and this is the diamond shaped one. So this is the triangle shaped one. And how come this both are corresponding means this lower half is present, no, right? We can see this is the cubital fossa, and here this is the popliteal fossa. So both are corresponding to each other, so these are called like homologous to each other. The cubital fossa which are present on the in front of the elbow, and the popliteal fossa like which is present on the back side of the knee joint. This is all about the point, which is nothing but the homologous, okay. The popliteal fossa is a lower half of the, remember that point also, lower part of the popliteal fossa is homologous to the cubital fossa. And coming to the boundaries of, what are the boundaries of the cubital fossa? So cubital fossa is a shallow depression, we have already seen. So what is this boundaries? Let us see. We have two muscles bounded on each side, like lateral and the medial side. On the lateral side we have the brachioradialis muscle, and medial side we have the pronator teres muscle. And we can see this in picture clearly, right? I'll show a picture. Yes, this is the cubital fossa, otherwise called antecubital fossa. You can clearly see in this picture, this is the elbow joint, no, right? This is the elbow joint, and we have the cubital fossa here. It is a shallow depression, and the triangle, like a triangle is the apex is pointing downwards, right? This is the apex and this will be the base. So if it is a triangle, then definitely this is the base, right? And this is the apex, which is a pointed one. So apex is pointing forwards and the base is backwards, okay. Remember like this. So another picture we can see. Yes, this is also the same picture. We can see the cubital fossa here also, the triangle. The apex is pointing forwards and base is like this. And we can see the lateral epicondyle of the humerus. Here the bone will be humerus, no. So this is the lateral side. Definitely the thumb is present, so this is lateral side. And the little finger is present. This is the medial side of the body or the hand, right? So this epicondyle is the lateral epicondyle, and this is the medial epicondyle of the humerus. And the cubital fossa is seen here, the triangle depression, shallow depression, and the muscles we can see in another picture, right? I'll show in another picture. This is also one more picture which is showing the cubital fossa. In this picture, why I picked this picture? Because we can see the cubital fossa very prominently, right? The median cubital vein, because this is a gym body, so we can see very clearly the cephalic vein, basilic vein, all those things. So this is the biceps brachii muscle, which can be seen on the arm region. And this is the basilic vein which can be seen on the medial side, right? This is the medial side of the body and this is the lateral side. So on the lateral side we have the cephalic vein, on the medial side we have the basilic vein, and this is also, this one is a cephalic vein, right? This is also cephalic vein. This entire thing is a cephalic vein, and I'm drawing now this entire thing, and this is the basilic vein, right? And pronator teres muscle here, whatever seen on the medial side, the muscle is a pronator teres, and the muscle here on the lateral side present, no, these are the brachioradialis muscle. So we can clearly observe the veins here in this picture, right? We can see the basilic vein. One is the basilic vein which is present on the medial side, you need to remember, and the cephalic vein which is present on the lateral side of the body, right? So the two muscles are bounding the cubital fossa. One is the pronator teres, another one is the brachioradialis. The pronator teres will bind on the medial side, okay, this is the medial side, no, and the brachioradialis will bind on the, like it will be bounding on the lateral side of the hand of the cubital fossa. And this is the two veins which are prominently seen in the superficial fascia just below the skin, So here we can see the prominence of the cephalic vein on the lateral side, basilic vein on the medial side. Another one, this vein is present. This is called a medial vein of the forearm. Definitely on the superficial fascia, superficially what we can palpate are the veins, right? Because they are superficially arranged. So we can see in another picture what are the boundaries of the cubital fossa. Right. This is the picture which is showing the cubital fossa. First of all, see, I'll draw a line like this. I'll draw with another color so that you can identify. Right, this one, whatever I'm drawing in the sky blue color, this is the cubital fossa, triangular, okay, triangular shallow depression in front of the elbow region. This is called cubital fossa. So coming to the boundaries on the, so we can see first of all we can orient what is the medial side and what is the lateral side. This is the medial side of the body, okay, right, and this is the lateral side of the body, like means hand, okay. Now we are discussing the cubital fossa, no? So definitely hand. This is the medial side of the hand, I mean arm and the forearm region present, the medial side of upper limb, okay, right. This is the medial side of upper limb and this is the lateral side. So this muscle is the pronator teres muscle and this muscle is the brachioradialis. Take a look, right. You can observe the brachioradialis muscle present on the lateral side and the pronator teres muscle present on the medial side, right. So again we have the two borders regarding this pronator teres. This pronator teres on the medial side, it is the medial side of pronator teres and this one is the lateral side of the pronator teres, right, and this is the medial side of the brachioradialis and this border is the lateral border of the brachioradialis. Now you can say here what is the border on the medial side? Lateral border of the pronator teres muscle form the medial boundary of the cubital fossa, right. I'll again repeat, the lateral border of the pronator teres is the medial boundary of cubital fossa. Simultaneously, the medial border of the brachioradialis forms the lateral boundary of the cubital fossa, right, and apex is present. Apex is actually pointed and facing forwards, like, okay, facing downwards here, and it is formed meeting point of brachioradialis muscle and the pronator teres muscle. And base, here we can see the lateral epicondyle on the lateral side and this is the medial epicondyle of the medial side. So both the points, the medial epicondyle here on the medial side and the lateral epicondyle on the lateral side, meeting point an imaginary horizontal line, that is called the base of the cubital fossa. Understood? So these are the boundaries of cubital fossa: medial side, lateral side, base and apex. And we have two more boundaries also, floor and roof. We can see already we have seen the roof, what are present, like veins are present, no, roof is formed by skin, superficial fascia, right, and then deep fascia and then the veins, which are superficial veins present in the superficial fascia. That also we can see in another picture, right. This is the roof of the cubital fossa. So the cubital fossa mainly having, first of all, skin is present, right, and then superficial fascia is present. In that superficial fascia we can see the basilic vein, cephalic vein and the vein which is connecting the both cephalic on the lateral side and basilic on the median, right. Both the veins are connected by median cubital vein. This is one more important point. Median cubital vein connects the cephalic vein and the basilic vein which are present in the superficial fascia. And then what are the contents of the roof of the cubital fossa? Skin, superficial fascia, cephalic vein, basilic vein, and then the median cubital vein which is connecting this both, and this all present in the superficial fascia, right. And then bicipital aponeurosis and two more nerves, right. This is the medial cutaneous nerve of forearm. Why it is called so? The name itself says it is present on the medial side and of the forearm, right. Forearm, it will supply to the forearm, and cutaneous, nothing but skin, right. And this is the lateral one, present on the lateral side and supplying to the skin, that's why cutaneous, and nerve of the forearm, right. The name itself says the medial cutaneous nerve forearm present on the medial side and the lateral cutaneous nerve of the forearm present on the lateral side. So finally, what we are seeing in this roof of cubital fossa, we can see the skin, superficial fascia, again the superficial fascia which is containing the cephalic vein, basilic vein and the median cubital vein which is joining the cephalic and the basilic veins, right. And then bicipital aponeurosis and two more nerves. What are they? The medial cutaneous nerve of the forearm and the lateral cutaneous nerve of the forearm. Entire structures present in the roof is all this, right. So learning through diagrams make the content very easy, so please go through the diagrams. And coming to the next boundary, that is the floor of cubital fossa. So the floor is mainly formed by two muscles. Remember the two muscles, one is the brachialis muscle, another one is the supinator muscle, right. Definitely the name itself indicates what is the action of the supinator. Yes, supination of the forearm, right. And then this is another picture which is the cross section of the both the muscles. So we can see the supinator muscle and this is the bone, radius bone, and this is the ulna. This is the brachialis muscle, right? Same one, and we have another prominence like tuberosity is present, that is the radial tuberosity. So supinator and the brachialis muscles both will form the floor of the cubital fossa. This is all about the what are the boundaries of the cubital fossa. Now you can understand better what are the boundaries. So say lateral one, we have the medial border of the brachioradialis, accepted, and another one the medial one. Medial boundary is the lateral border of the pronator teres. Apex means meeting point of lateral and medial boundaries, that is nothing but the brachioradialis muscle on the lateral side and the pronator teres muscle on the medial side. Okay, but here we need to take an extra edge. Remember this point, that brachioradialis overlaps the pronator teres. Please remember this point. The brachioradialis will overlap the pronator teres, which means pronator teres will present below, right? And then upon that the brachioradialis will be present. And then the base is formed by imaginary line, which is a imaginary horizontal line, right, joining between the two epicondyles, that is the epicondyles of the humerus, medial epicondyle of the humerus and the lateral epicondyle of humerus in front of the elbow, right? Clear with the boundaries? And then coming to the roof, it is formed from the superficial to deep by the skin, superficial fascia, and the superficial fascia already explained, the cephalic vein on the lateral side, basilic vein on the medial side. In between, the median cubital vein is present, which joins the cephalic vein and the basilic vein. Okay, that only I written here, connecting the cephalic and the basilic veins, and then medial cutaneous nerve of the forearm, lateral cutaneous nerve of the forearm, and then deep fascia. Actually this deep fascia is reinforced. Reinforced means strengthen. Okay, it is reinforced by bicipital aponeurosis. Please remember this point. The deep fascia, what are the structure present in the superficial fascia and what are present in the deep fascia? Deep fascia is nothing but the bicipital aponeurosis. Now the general anatomy works here. What do you mean by the aponeurosis? Yes, it is nothing but the flattened tendon, right? The flattened tendon of the biceps brachii muscle. First of all, the belly, like this, the origin may takes place, and then belly of the biceps brachii will have, and we have the tendon. This is the lateral side and this is the medial side. Assume like this, and the tendon will present like this, and the flattened tendon, one more tendon present here. This is called the shaded region. This one is called the bicipital aponeurosis, right? You got it? So this is all about the roof. And coming to the floor, right? Yes, floor is mainly formed by two muscles, that is nothing but the brachialis in the upper part and the supinator in the lower part. And then coming to the contents, what actually present in this cubital fossa. Actually the cubital fossa is not that much spaced. Okay, it is a narrow space, and the contents are displayed only when you make the elbow flexed and then margins are pulled apart. So the hand will be present like this. No, this is the arm region and this is the forearm. So you need to flex. Flex means like this, you need to make angle, you need to decrease the angle between the arm and the forearm region, so that the upper limb is flexed, so that you can see the contents of the cubital fossa very clearly. Okay, first of all you need to observe the cubital fossa contents, means you need to flex the elbow, and margins you need to pull apart, then only you can see the contents clearly. And there is a mnemonic to remember the contents from the medial to lateral side. Okay, MBBS, that is the course we are doing now. So MBBS means, M means the median nerve, okay, B means the brachial artery, so biceps tendon is for another B, and then superficial branch of the radial nerve. Okay, so it starts with a nerve and ends with another nerve. Remember like this also, right? Median nerve, and the last one is the superficial branch of the radial nerve. In between again you have a confusion, both are B, no, which one comes first, brachial artery or the biceps tendon? Go with the, like, after the nerve will come and then the artery will come. Okay, remember like this, after the nerve definitely there is an artery. Okay, here the nerve is median nerve and the artery is the brachial artery, and then the tendon will come, that's a biceps tendon, and then the superficial branch of the radial nerve. Okay, this is all about the contents. We can see in the picture also. Let us discuss in detail. Okay, the median nerve actually leaves the fossa, cubital fossa, by passing in between the two heads of the pronator teres. Which muscle is present bounding on the medial side of the cubital fossa? Yes, the pronator teres, and definitely the median nerve is also on the medial side. So it need to pass through the pronator teres, and the pronator teres will have two heads. So in between the two heads the median nerve will pass. If you may get an MCQ, which a structure will pass in between two heads of the pronator teres, or which nerve will pass in between the two heads of pronator teres? The answer is the median nerve. Okay, median nerve will pass in between the two heads of the pronator teres. And coming to the brachial artery ends in the fossa at the level of neck of the radius, because the brachial artery like it will divide at the neck of the radius, it will divide into the radial artery and the ulnar artery, right? So artery always divide and vein always have the tributaries, artery always have the branches. So these are the two branches of the brachial artery. One is the radial artery, another one is the ulnar artery, because this radial artery is superficial and ulnar artery is very deep, okay, it will go deep inside, and the radial artery will become superficial. That's why okay, the radial artery is superficial and ulnar artery is deep. Remember like this, okay. At which level it divides? At the neck of the radius, the brachial artery is dividing into radial and ulnar artery, right? We also completed the contents. First of all, completed the brachial artery. And coming to the brachial artery, actually the radial artery will leave the fossa. First of all, brachial artery is present. It already divided into radial artery and the ulnar artery. Ulnar artery present on the medial side and the radial artery present on the lateral side. Radial artery leave the fossa at the apex, okay. Ulnar artery pass deep to which muscle? This is also another MCQ. Ulnar artery passes deep to pronator teres. Like pronator teres, in between two heads of pronator teres one structure will pass. What is that? The median nerve, okay. And then deep to pronator teres another structure will pass, that is the ulnar artery. Remember, ulnar artery. Nerve passes in between the two heads and ulnar artery passes very deep. Artery is always deep, no? Okay. And then biceps tendon. So it passes backwards and laterally attached on the radial tuberosity. So insertion of the biceps brachia also the radial tuberosity, neck of the radius. So you can remember like this, biceps tendon also inserted or attached on the radial tuberosity. And coming to the another one, that is the radial nerve. We completed MBBS, no? So median nerve is completed, that is passing in between the two heads of the pronator teres. And then brachial artery also divided into radial and the ulnar artery. Ulnar artery is deep and the radial artery is superficial. And then another one, that's a biceps tendon which is attached to the radial tuberosity. And coming to the superficial branch of radial nerve. Radial nerve actually lies in between the brachialis medially and the brachioradialis laterally. Okay, two muscles will have, in between two muscles the radial nerve will present. And then at the level of the lateral epicondyle of the humerus, the radial nerve will divide. Okay, the radial nerve will divide into superficial branch and the deep branch. And now what make the content of the cubital fossa? Yes, the superficial branch of the radial nerve make the content, because it passes downward under the cover of the brachioradialis. The brachioradialis, how it is related to cubital fossa? It is the lateral boundary of the cubital fossa. So cubital fossa, and then the deep branch will disappear in the substance of the supinator. So it disappears in the supinator, okay, the deep branch of the radial nerve. This is all about the contents of the cubital fossa. Once in the diagram we can see the contents. What are those contents of cubital fossa? Yes, this is the diagram which is showing the contents of cubital fossa. This is the medial side again and this is the lateral side. So what is the medial most structure present? This is the median nerve, okay. Nerve always will be indicated with yellow color. Remember this point, okay. With yellow color, actually it is marked. The median nerve is present on the medial side. And then brachial artery. Here you can see it is dividing into two parts. Okay, this is the ulnar artery, right? This is the ulnar artery and this is the radial artery. So by seeing only we can see this is going very deep, right? And this is the superficial one. Radial artery is the superficial. Another one, this is the biceps cut section of the biceps brachii muscle, and this is the tendon of biceps brachii. And we can see the bicipital aponeurosis also here, which is present in the roof of cubital fossa. And lateral most structure is the, what is this? Yes, radial nerve. So again it is again divided into the one superficial branch and the another one is the deep branch. So deep branch passes very deep, and then this superficial one is present. No, it is actually passing. This is which muscle? Yes, brachioradialis muscle. So you can exactly see in the picture what we told in the matter, right? The median nerve, which means I'm really sorry, the radial nerve is present, and then it is dividing into superficial branch and the deep branch. First of all, radial nerve is, I will also draw with yellow color so that you will not get any. Okay, this is the radial nerve, and here it is dividing like this. So it is the superficial branch of the radial nerve, and this is the deep branch of the radial nerve. So the superficial branch will pass beneath the muscle, that is the brachioradialis muscle. Okay, clear with the contents? From the medial to lateral side we have MBBS, that is the median nerve, brachial artery, tendon of biceps. Another one is the superficial branch of the radial nerve. This is all about the contents of the cubital fossa. So last one, that is the clinical significance, which is very important. Clinical significance of the cubital fossa. So what is present in the cubital fossa? Median cubital vein. Where it is present? Yes, in the roof of it forms the roof of the cubital fossa, and it is present in the superficial fascia of the cubital fossa, right? It is present in the superficial fascia of cubital fossa, and it will connect, right? It will connect the which two nerves? One is the cephalic one on the lateral side and the basilic one on the medial side. So this will be the median cubital vein. Okay. So seen in the roof of the cubital fossa, already we discussed, and in the superficial fascia, and it is a vein of choice for collecting any blood samples or giving the IV injection. So right, this is the median cubital vein, which can easily palpable and which can easily pulsated to give the intravenous injections. Okay. Another one is a brachial pulse. So this is a brachial artery. It is universally used to record the BP, blood pressure. So the easily felt brachial artery, so it is taken for the brachial pulse is easily felt, so it is taken and choose for recording the BP. Okay, it is medial to the biceps tendon. Please remember this point. It is medial to biceps tendon. So we completed the two contents of the what is the clinical significance of cubital fossa, and there is another clinical significance. This is actually very important and an extra topic. Please remember this: supracondylar fracture. What is the supracondyle? Condyle nothing but it is related to one bone, that is the humerus. Okay, lower end of the humerus will have this condyle. The condyle, whatever the fracture occurs to this condyle of the humerus, that's called the fracture of, okay, fracture of the like supracondyle, so it is called supracondylar fracture. So whatever fracture occurs to the distal humerus, it is called the supracondylar fracture. Okay, distal part already we discussed, which is the proximal part of the body, distal part of the body, right? Every like every organ or the hand, upper limb, in upper limb also we have arm, forearm, everything is having its proximal end and the distal end, right? And coming to the hand, when we see proximally, it will be proximal phalanx, and distally distal phalanx will be present, right? And the carpal bones are present on the distal side. I am giving you orientation such which is a distal end and which is a proximal end. You got it? So the lower end of the humerus is nothing but the distal part of the humerus, and fracture is typically transverse or the oblique one. And what is the cause of the fracture? Means falling on the outstretched hand. Please remember this, and it is more common in the children compared with the adults. Okay. So what is the point we are discussing? The supracondylar fracture means it is related to the contents of cubital fossa. It will directly or indirectly affects the or injures the cubital fossa contents. Okay, so the contents of cubital fossa can be damaged either directly or by the soft tissue swelling following the trauma, so that indirectly it will injure the, like it will affect the cubital fossa contents. So one of the content is a brachial artery, right? So if it is not repaired, like any injury occurs to the brachial artery, like one falls on the outstretched hand, okay, some injury occurred to brachial artery, it is the content of cubital fossa. Directly or indirectly something happened to the injured happened to the brachial artery. If it is not repaired, in such cases the condition will occur, that's called Oakman's ischemic contracture. And now this will become such an important thing, Oakman's ischemic contracture. There will be the probability uncontrolled flexion of the hand will be present, and forearm flexor muscles become somewhat short and fibrotic. Okay, like simultaneously they will become fibrotic and short. So this will be happening when the supracondylar fracture occur. The cubital fossa content may affect, may injure directly or indirectly, and there also a chance of getting damage to the anterior interosseous nerve. And where come this nerve happen? Means it is a branch of the median nerve, and again this median nerve is a content of the cubital fossa, right? On which side it is present? Yes, on the median side medial side of the cubital fossa it is present, and it passes in between the two edges of the cubital, I mean pronator teres in the cubital fossa, right? And the ulnar nerve or the radial nerve, whatever may be, the injury may happen. Like the damage to anterior interosseous nerve may happen, which is a branch of median nerve. And here we can note 2 points, because this may ask as MCQs: the anterior interosseous nerve, posterior interosseous nerve. There is no need of confusing, because anterior interosseous nerve is a branch of median nerve, while the posterior interosseous nerve is a branch of radial nerve. Please remember this point. The anterior interosseous nerve is a branch of median nerve, and the posterior interosseous nerve is a branch of radial nerve. Okay, this is all about interosseous means bone. Okay, in between the bones, and radius and ulna are present in the forearm. No, these are the two bones. Interosseous membrane is present in between the radius and ulna, so almost the anterior interosseous and the posterior interosseous nerves will pass in that relation to the interosseous membrane. So that's why the nerves are so called. So these nerves are very deep. Okay, this is all about the cubital fossa contents and the clinical aspect which is related. So please remember, the clinical anatomy is very important, so please go through it. And this is all about the session today. So stay tuned for the another topic. So please like, share and subscribe to this channel. If you subscribe, then you will get each and every notification of my next videos. And join the Telegram channel or follow me on the Insta for the notes of the video. And thank you so much for your support. Thank you.